If you've been told that you need a crown or a root canal, the real question isn't what procedure you need. It's what condition is your tooth in. We are going to talk today about 3 primary questions that you need to be finding out. The first is this tooth alive or dead? The second is how much enamel is remaining on the tooth? And the third is what does this tooth need to continue functioning for you? Let's jump into the first one. First of all, is the tooth alive or dead? Why does this matter? As soon as the nerve is removed, everything changes. A tooth that's alive can heal itself. It can regenerate. A lot of things can happen inside of that tooth. A tooth that is dead has lost all of that ability. It becomes more brittle. It now has the potential for infection. So, how do you determine which side of the fence you're on? The first thing you can go on is your symptoms. If you have cold sensitivity or sweet sensitivity, those are actually good signs. Typically that means that the tooth is still alive. Inside of the tooth there is a center portion called the pulp. That pulp contains the nerve and the blood vessels. If that nerve is alive, the blood vessels deliver nutrients and healing. We want that nerve to stay healthy and intact. Now, what signs show you're on the other side? Swelling at the end of the root, pus, or severe pain when biting. If it's waking you up at night, or it starts to hurt all on its own, these are signs the tooth may be dead. Once that nerve dies, it gets infected. Any dead tissue in the body is going to attract bacteria. That pressure is what hurts so bad. Once it extends beyond the tooth, it creates a painful bubble every time you chew. You need to visit your dentist to find out if it is alive or dead. Sometimes we can see this on an X-ray. We also check symptoms. We might put cold on the tooth to see if you can feel it, or ask about sweet sensitivity. Once the nerve is dead, the only option is a root canal to remove dead tissue, or removing and replacing the tooth. If the tooth is alive, options include treating the pulp or selectively removing the cavity while leaving a deep portion in place. We then use ozone right there on that infected dentin surface, and it kills all of the bacteria. We fill over it without killing the nerve. This is where dentistry is going. Keep the tooth alive if you can. Next question. What about a crown? Enamel is amazing. It's the outside surface and it never grows back. It's stronger than anything we can put on your tooth. It's also what we bond porcelain to. Enamel is key. If the tooth is broken or has heavy decay, a full crown replaces the enamel. All enamel is removed for the porcelain. If there is still good enamel left, you can do partial coverage restorations like an onlay. We leave the good enamel behind. Ask your dentist, is my tooth alive? How much enamel is here? And what do we need for long-term chewing? My mission is to help you live well. If you have a healthy mouth, you can have a healthy you. Subscribe for more.